The Centers for Disease Control recently released new coronavirus guidelines on Tuesday. They say fully vaccinated Americans can go outdoors without wearing a mask. The easing of mask suggestions also, in some cases, applies to those who have not been fully vaccinated. Joining us now to talk more about this is Dr. Bob Lahita, director of the Institute for Autoimmune and Rheumatic Diseases at St. Joseph Health. He is also a clinical professor of medicine at Rutgers, New Jersey Medical School and professor at New York Medical College. Dr. Lahita, welcome back. Always great to see you. Let's talk a little bit more about these new mask guidelines. The CDC says fully vaccinated people, meaning those who've had both shots, can go maskless outdoors with some exceptions. Can you talk more about that and also your thoughts on the new guidance and what it signals?
Yes, Tracy, it signals that when you're vaccinated, you're protected. We have real world data now with thousands, indeed millions of people who have been vaccinated, and it is clear that the infection does not spread from individual to individual in those who have received the vaccine. You have to be 2 weeks out from your second injection or 2 weeks out from your first injection if you have one of those single injection vaccines. So you're basically protected, which means that small groups of people inside and outside, if you've been vaccinated, do not have to wear masks. Now, still in public places like churches, temples, synagogues, you do not know who in that congregation is still unvaccinated and therefore is capable of transmitting the infection or of even receiving the infection from someone else. So there's still possibly super spreader events. But if you're vaccinated, you're fairly protected. If you're jogging in a park, you don't have to wear a mask. If you're outdoors at a picnic or barbecue and you're with other vaccinated people, you don't have to wear a mask. It's those people who are unvaccinated or not vaccinated that are at risk of spreading and of receiving the virus.
Well, as we know, as the CDC did ease those mask restrictions for outdoors, what about indoors for those who are fully vaccinated and for those who aren't? And also, what did the CDC have to say about that?
Well, the CDC said that if you're indoors and you know that your family's been vaccinated, you don't have to wear a mask. In fact, we suggested you didn't have to wear a mask beforehand if you knew that the people in your home were not exposed to the virus. But one never knows. So vaccination is the way to go. That's a sure thing, a sure test of the fact that you are now going to be resistant to infection. Of course, little children, like grandchildren, etc., are usually not really susceptible. If they do get infected, they're asymptomatic, and most children have not been out and about in an area where, or in groups where they could be infected. So this is good news. It means that if you're vaccinated, you don't have to wear a mask anymore. But remember, when you're in public places like theaters, football games, baseball games, you really do have to wear your mask and social distance.
Dr. Lahita, we probably have about a minute or so left, but I want to get to this last question. There have been reports that millions of people are not getting their second doses of the Pfizer and Moderna vaccines. What more do you know about that? And what are the concerns there regarding skipping that second dose?
Well, the second dose is there for a reason. This messenger RNA Moderna and Pfizer vaccine requires the booster dose. The data from the phase 3 clinical trials indicated that the second dose was essential to provide good cellular and humoral immunity, which means antibodies and cellular immunity. If it's going to be effective, you've got to get the second dose. And people who are going and not getting the second dose are really not fully vaccinated.
Well, Dr. Lahita, thank you so much for coming on. Always appreciate your expert advice. Dr. Bob Lahita, thank you again for joining us.
Thanks.